Mixed-action adrenergic agonists stimulate a sympathetic nervous system or fight-or-flight response, making them sympathomimetics. They stimulate alpha and beta receptors in two ways, directly and indirectly. They directly stimulate alpha and beta receptors by binding to them, causing stimulation, whereas they indirectly stimulate alpha and beta receptors by increasing the release of norepinephrine from presynaptic adrenergic neurons. The released norepinephrine then binds to alpha and beta receptors, leading to further stimulation. Although mixed-action adrenergic agonists stimulate alpha and beta receptors, the clinical significance lies in their ability to stimulate alpha-1 and beta-1 receptors. Alpha-1 receptors are mainly found in veins and arteries. When alpha-1 receptors are stimulated, it causes vasoconstriction. This increases systemic vascular resistance and therefore blood pressure, whereas beta-1 receptors are mainly found in the heart. When beta-1 receptors are stimulated, it causes a positive inotropic and chronotropic effect, meaning the heart's force of contraction and rate increase. This causes an increase in cardiac output and therefore blood pressure. The most common mixed-action adrenergic agonists are ephedrine and pseudoephedrine. Ephedrine is administered intravenously, and its ability to increase systolic and diastolic blood pressure is used to treat hypotension, in particular anesthesia-induced hypotension, whereas pseudoephedrine is administered orally, and its vasoconstrictive effect is used to treat nasal and sinus congestion. Adverse effects of mixed-action adrenergic agonists include hypertension, tachycardia, dizziness, nervousness, and insomnia. Pseudoephedrine can additionally cause seizures and cardiovascular collapse. Pseudoephedrine should not be used with hypertension, severe coronary artery disease, or with MAO inhibitors. The concurrent use of MAO inhibitors can cause a hypertensive crisis. When using ephedrine, it's important to closely monitor blood pressure, heart rate, and rhythm using bedside telemetry. It is also important not to confuse ephedrine with epinephrine. When using pseudoephedrine, assessing nasal and sinus congestion, blood pressure, and pulse before and throughout therapy is important. It is also important to do a respiratory assessment, including auscultation, respiratory pattern, and color and character of sputum. It is also important not to confuse Sudafed, a trade name for pseudoephedrine, with Sotalol, a beta blocker. I hope you found this video useful. If you did, please let me know by giving it a thumbs up, subscribing, and leaving a comment below. Thank you, and bye!